Hi, I'm Monica Owens Doyle. I'm the Program Manager for Community Preparedness and Resilience Services, and I oversee our day-to-day execution of the Home Fire campaign. I'm here today to share a little bit with you about making households safer through in-home visits as part of our Home Fire campaign. Home fires kill on average 2,500 people per year in the United States, most in homes that lack working smoke alarms. That is why the American Red Cross launched the Home Fire campaign, which aims to reduce home fire deaths and injuries. We know that working smoke alarms cut the risk of dying in a home fire by half, and having an escape plan further improves the odds of survival. The cornerstone of the Home Fire campaign is the Sound the Alarm, a series of year-round events where the Red Cross and partners conduct in-home visits in at-risk communities, sharing fire safety education and installing free smoke alarms. Home fires can affect anyone. We focus our efforts on at-risk households because we know that home fires do not affect everyone equally. Research shows that individuals most at risk of dying in a home fire are individuals living in poverty, older adults, individuals with disabilities, access, or functional needs, children under the age of 5, and minority communities, in particular Native Americans or Alaska Natives, followed by African Americans. Fire deaths are not an inevitable consequence of any factor. Effective programs can reduce fire death rates over time. We focus our efforts on providing in-home visits because research indicates that services delivered inside the home are an effective way to reduce the incidence of home fires and home fire fatalities. Home Fire Risk Map. Use the Home Fire Risk Map to identify communities where the risk of experiencing a home fire and the risk of dying or becoming injured in a home fire is the greatest. The Home Fire Risk Map is an easy-to-use planning resource to identify communities that are most at risk based on data collected from the Client Assistance System, CAS 2.0, the Home Fire Campaign, the National Fire Incident Reporting System, and the American Community Survey, as well as the American Housing Survey. The targeting begins at the national level and then guides the user to understand the risk of profiles, regions, cities, and neighborhoods. The darker the red, the higher the fire risk. As you navigate the tool and zoom in on your region, you can better visualize the at-risk neighborhoods in your service area. Consult local fire departments to gather their perspective too. Training resources are available on the Home Fire Campaign Toolkit on the Exchange. We encourage you to share the Home Fire Risk Map with partners. This tool was created by DataKind DC, a nonprofit data analytics team, in collaboration with the Red Cross. Each year, we have a target to make a certain number of households safer through in-home visits. For the national figure and the regional breakdowns, please see the Humanitarian Services Goals and Metrics site, as well as the Disaster Cycle Services Regional Reporting site. Each region receives an allocation of smoke alarms to install and educational materials to use to achieve the region's Households Made Safer target. How do we define an in-home visit to make a household safer? In-home visit defined. An in-home visit takes place when an adult resident invites an in-home visit team, minimum of 2 people required, into a home, and the in-home visit team provides any one or a combination of the following services and documents them on a service acknowledgement form. Pre-existing smoke alarms tested and found to be working, batteries replaced in pre-existing smoke alarms, new smoke alarms installed, new bed shaker alarms installed for individuals who are deaf or hard of hearing, home fire escape plan created, or a home fire safety checklist reviewed. Upon the conclusion of each in-home visit, each household should have at least one working smoke alarm on each level of the home. All in-home visit records are credited based on the reporting date. For example, the date the service acknowledgement form data is entered into the online reporting portal. So you might find yourself wondering what exactly counts towards the Households Made Safer metric. Please note the following. Record only in-home visits on service acknowledgement forms, and only in-home visits contribute towards the Households Made Safer metric. You have to actually go into the client's home to perform the service delivery for it to be able to count. Important, please note the following. Do not record community presentations or event tabling on service acknowledgement forms. Community presentations can be used to generate future in-home visit appointments if the audience falls with one of the high-risk demographic groups. For example, older adults, individuals with disabilities, individuals who have low income, etc. Do not record discussions on doorsteps on service acknowledgement forms. Remember, educational materials provided to the regions are allocated based on the region's Households Made Safer target. Therefore, regions should not leave behind educational materials if no one is home. We care about you and your safety. Red Cross volunteers, partners, and employees are encouraged to ensure that their homes have working smoke alarms, have developed and practiced home fire escape plans, and share and practice ways to prevent home fires. However, these activities should not be recorded on service acknowledgement forms. Red Cross volunteers, partners, and employees who cannot afford smoke alarms or who are unable to install them on their own may request an in-home visit through existing chapter or regional protocols, but smoke alarms should never be distributed to staff and volunteers for self-installation. Since our program team frequently receives questions about what counts and what doesn't towards the Households Made Safer metric, I wanted to take a moment to review a simple chart with you to help generate some clarity around this topic. The only activity that counts towards the Households Made Safer metric is an in-home visit that is completed. Doorstep discussions where you talk to somebody on their front porch, those don't count. Event tabling, like if you're at a county fair, that does not count either. Community presentations around general preparedness does not count, though it can be a great way to generate appointments for future in-home visits. Education provided to Red Cross staff or volunteers doesn't count either. And under this program, self-installations are not allowed. Under no circumstances should employees, volunteers, or partners receive smoke alarms to install for themselves at a later date. Remember, the maximum allowable average number of smoke alarms installed per home is 3. This allows for latitude in service delivery to ensure that each floor of a home has at least one working smoke alarm. Regions may install 1, 2, 3, or more alarms per home based on need. Adhering to this policy allows us to reach as many households as we can, given our limited resources. Exceptions. If a partner provides all of the smoke alarms, defer to their guidelines for installing more than 3 smoke alarms per home. If a partner is supplementing Red Cross sourced smoke alarms with their own, install up to 3 Red Cross sourced smoke alarms in the home. If the partner wishes to install additional non-Red Cross sourced smoke alarms, defer to their guidelines. Bed shaker alarms for individuals who are deaf or hard of hearing do not count towards the 3 alarm maximum average per home. Monitoring performance. Regularly monitor your performance to ensure that average number of smoke alarms installed per home does not go above 3. You can find this information in the Disaster Cycle Services monthly reporting dashboard on Power BI at the link provided here. Every division has their own dashboard with access to their specific data. You can view your division results in the dashboard as well. On the region HMS slide, a link has been added that says select here for useful indicators related to the home fire campaign by region and chapter. Click on this link and you will find your average number of alarms installed per home. So to recap, you select your division, you go to the region Households Made Safer, and then you select the link, select here for useful indicators, and you can monitor your average number of alarms installed per home. And try to keep your average number of alarms installed per home in the green, which is 0 to 3. How to increase households made safer. Make sure you don't leave out the most vulnerable members of your community. To increase the number of households made safer, provide a full suite of program services in at-risk homes, regardless of housing type or ownership status. The Red Cross aims to deliver services to the most vulnerable, regardless of whether a property manager or landlord is legally responsible for fire safety and prevention. It is important to provide an opportunity for residents living in low-income rental units, public housing, subsidized housing, and mobile homes to participate and receive in-home visits. Even if smoke alarms are already included in units and/or laws or local codes require them, the Red Cross can add value by testing existing smoke alarms to ensure that they are working, installing new smoke alarms or bed shaker alarms as required, changing batteries if required and available, assisting residents in the creation of home fire escape plans, and sharing ways to prevent home fires. Defer to the decision of residents themselves who are at least 18 years old as to whether or not install smoke alarms. Residents may request additional time to check with the owners to get permission, and if they do, respect their wishes and follow up later if needed. Public housing facilities, subsidized housing, and low-income apartments. The aim of public and subsidized housing is to provide decent and safe rental housing for eligible low-income families, older adults, and people with disabilities. While the Department of Housing and Urban Development, or HUD, oversees the public housing program, it is administered locally by 3,300 public housing agencies. The difference between public and subsidized housing depends on who owns the facility. With public housing, the housing authority owns the building and is the landlord and is legally responsible for ensuring the safety of the building and the units, including the installation and maintenance of smoke alarms. However, the Red Cross may still conduct in-home visits and install smoke alarms in these residences. Subsidized housing. The housing authority is not the landlord. Subsidized housing is owned and operated by private owners who receive subsidies in exchange for renting to low and moderate income people. These owners are legally responsible for ensuring the safety of buildings and units, including the installation and maintenance of smoke alarms. However, the Red Cross may still conduct in-home visits and install smoke alarms in these residences. Contact public housing authorities and agencies in your area to see if they would be interested in partnering with the Red Cross to provide home fire safety in-home visits to residences. For public housing agency contact information, please see the link below. Now I'd like to welcome Guillermo Sanchez of the Los Angeles region to share about his region's success with the partnership with the Housing Authority of the City of Los Angeles.
Hello everyone, I am Guillermo Sanchez, the Regional Preparedness Manager for the Los Angeles region, and thank you for the opportunity to share with you my experience working with Housing Authority of the City of Los Angeles, also known as HACLA. We started this partnership back in the summer where we had a meeting with the Program Service Coordinator for HACLA. And in this initial meeting, we kind of got to know each other. I described all the different programs, all the different preparedness programs the Red Cross offers, as well as what she does within HACLA as well. After all that was done, essentially, she latched on to our Be Red Cross Ready program and hands-only CPR program, as she saw a natural connection to what they are already doing, which was they have regular monthly tenant meetings, and at these meetings they're always looking for content to provide to the residents. So it was a natural fit for her to be able to offer this to their residents. So as a way to kind of test the waters and see how this relationship would work or partnership would work, we decided to start small and pilot our programs in 5 of their units. And so we did 5 Be Red Cross Ready and 5 hands-only CPR presentations at 5 of their complexes throughout August, September, and October. Once we were done with the presentations, I had a follow-up meeting with my contact at HACLA, kind of to review what had just occurred with the presentations and kind of get her feedback, and all the feedback we had gotten was thankfully great. It was great positive feedback from the managers and the tenants who had gone through our presentations. And so I think this opened up the door then to be able to begin the conversation with her about expanding the program a little bit and the partnership. That was a great natural fit to offer more presentations and expand what we already had started. So we were given the opportunity to then start reaching out to 20 of their complexes that they manage, which roughly translates to around 6,000 potential units that we can knock on and offer the Homes Made Safer education canvassing only. And so back in December, we started to test it for ourselves and try this out. And so in December, we chose 3 different units, 3 different housing complexes, with roughly 800 homes collectively among those 3 housing complexes. And in a span of 2 weeks, we knocked on all those doors. And lo and behold, to our surprise, we were able to get 252 homes to open their door, and where we offered the escape plan portion of it and the home fire safety visit of the home fire campaign. And so we were able to get those plans created and those visits accomplished in 252 homes. So this really is an eye-opener for us, seeing that we can be successful, and hopefully we can replicate this in the remaining units. So if this is the case, I think we'll be able to have a great impact in our area, in our Homes Made Safer numbers for the region this coming year. I know this is a very high-level, brief explanation of how we are working the housing partnership here in Los Angeles. So if you would like a little bit more detail, talk through some ideas, kind of more about what the experience was during the canvassing, I'd be happy to talk to you more. Feel free to email me at guillermo.sanchez@redcross.org. Happy to set up a call with you and chat more with you. Thank you again for the opportunity, and hopefully you guys found this informative. Thank you.
Mobile or manufactured home communities. Manufactured housing, commonly referred to as mobile homes and trailers, offer the largest source of unsubsidized affordable housing in the United States, providing an estimated 5.6% of Americans with shelter, or 17.7 million people. 1 in 10 households living below the poverty line live in mobile homes. Mobile homes house both owners and renters. An estimated 71.1% of mobile home households own their homes, while 28.9% rent. The residents that own their mobile homes still need to rent their trailer lot and pay for utilities to stay in a trailer park. Residents living in these homes should be given the opportunity to participate in in-home visits. They face unique risks. Their homes are less likely to have working smoke alarms. They are more prone to remove or disable smoke alarms due to frequent nuisance alarms. They are more likely to live in poverty and be older adults. They are at greater risk of dying in a home fire as a result of improperly used heating equipment because thin insulation prompts increased use of supplemental room heaters, such as space heaters, kerosene heaters, gas space heaters, and electrical heaters. They are more likely to smoke. They are more likely to experience electrical fires due to overloaded electrical sockets. They are at greater risk of tornadoes and other high wind events. Contact management offices of mobile home communities in your area to see if they would be interested in partnering with the Red Cross to deliver in-home visits to residents. Enlisting the support of management agencies can help facilitate event planning and service delivery. Consult local fire departments to gather their perspective, too, on mobile home communities to engage in your area. For an interactive web map, which features an inventory of mobile home parks, locations, addresses, and the number of mobile homes within those parks, please see the Department of Homeland Security's Homeland Infrastructure Foundation Level Data, or HIFLD, at the link below. Now I'd like to welcome Jose Bueno of the Central Florida region to share about his region's success serving residents of mobile home communities.
Hi there, my name is Jose Bueno and I'm the Preparedness Manager in Central Florida and the subject matter expert in mobile home park installation events. Today I would like to talk about Barefoot Bay Mobile Home Park. Barefoot Bay has 5,000 homes and is the second largest in the nation. To date, we have installed more than 5,000 alarms and visited about 1,700 homes. We do installations the first Saturday of every month in that park. So what's the secret? Our secret is the relationship between the Red Cross and the park's homeowners association. The HOA provides teams of volunteers for every event. They advertise and enroll residents via their Facebook page, at social events like bingo and karaoke. Local residents also use their golf carts to transport Red Cross volunteers and the supplies, as the park is pretty large. Last but not least, they always have a barbecue or pizza with the teams at the end of the event to celebrate the success. It's a lot of fun, guys. If you would like to learn more about mobile home parks and Barefoot Bay, please contact me at jose.bueno@redcross.org.
Type of housing in lives saved households. As of December 31, 2019, we have 224 households in which in-home services were utilized by residents to save their lives during a home fire. Types of housing represented: So 132 or 59% resided in single-family homes, 62 or 28% resided in mobile homes, 30 or 13% resided in apartment or multifamily housing. There is a need to increase our outreach to residents who reside in apartments, multifamily housing, and residents who reside in mobile homes. Ownership status for lives saved households. As of December 31st, 2019, we have 224 households in which in-home services were utilized by residents to save their lives during a home fire. The type of housing represented. 132 or 59% of these were single-family homes, and the majority of those are owned. 62 or 28% were mobile homes, and the majority of those were owned as well. 30 or 13% were apartment or multifamily housing units, and the majority of these are rentals. This is just a reminder that there's a need to increase our outreach to people who are renting their homes, whether they're in apartments, mobile homes, or single-family homes. Additional resources. For more resources, please see the Home Fire Campaign Toolkit on the Exchange at the link provided. In addition, you can contact our team, Community Preparedness and Resilience Services at cprs@redcross.org at any point in time if you have any questions. Thank you for all the amazing work that you all are doing each and every day. Please submit any questions or feedback that you have about the information presented during this video via the WUFRU survey at the link provided. You can also request coverage of additional topics for future sessions there. Our team will hold a live Q&A session to answer any questions, and we will also post a frequently asked questions document. I hope that you found this recording helpful, and I also want to thank our guest speakers, Guillermo Sanchez of the Los Angeles region and Jose Bueno of the Central Florida region for lending their time and talent to this conversation. Our team is here to help you. Please reach out to your division POC or to our team if you need any support with your Sound the Alarm program. Your work matters. As of December 31st, 2019, your efforts since the campaign launch have resulted in 699 lives saved. This is truly remarkable. Keep up the great work.